being self-aware about possible traumas, whether it's at healthcare professional level, whether it's childhood, that's affecting your professional work because I see it in so many places.
Hey, what's up? This is Corey Dion Lewis, clinical health coach and host of the Healthy Project podcast. Now, the research shows that social determinants can have a greater impact on your health more than healthcare or lifestyle choices. The purpose of this podcast is to discuss how to improve health and reduce health inequity by speaking to healthcare professionals, thought leaders, and entrepreneurs. Now, if you're enjoying the podcast, give it a review. Or you can also make a donation to the Healthy Project using the link in the description. It takes 30 seconds and it's super easy. Hey, thank you so much for listening. Now let's get started. Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. I have a great guest with us today. She's a pharmacist and co-founder of Patients for Patient Safety activist. I have Dr. Soojin Jun. Soojin, thank you so much for being on the podcast with me. I really appreciate it.
Thank you, Corey. Thank you for having me today.
Yes, absolutely. So, before we get into the conversation, can you tell the people a little bit about yourself and, what gets you up in the morning?
What gets me up in the morning? So I'm a pharmacist. I work as a population health pharmacist, and I am also a patient safety activist. I'm a co-founder for Patients for Patient Safety US. We are an organization dedicated to ensure that organizations in the United States are aligned with what WHO is pushing for according to the Global Patient Safety Action Plan 2021 to 2030. We are very passionate activists who either have experienced medical harm ourselves or have lost our loved ones through medical harm. So all of us had to transform our lives and also advocate for other people and patients, caregivers, and clinicians also. So that's what I do, and that's what I get energized. That's where I get energy from to get up in the morning, to answer your question.
Yeah, absolutely. So, it definitely sounds like you are, a huge activist, in this public health area. Where did your motivation to really get involved in this? Where did it start for you?
So before I became a pharmacist, I was a caregiver for my father, who was a foreigner from South Korea, and he was a businessman, had no healthcare background, and so was I. I was a wedding videographer at the time. And the care that I had to help him with was very challenging. So he was a stage 3 esophageal cancer patient. And, he was in hospital then he was transitioned to nursing home. Then he came home, and during that transition, he was also diagnosed with diabetes. And his primary care doctor prescribed something called insulin as its common medication that diabetic patients get prescribed for. And there is a method called sliding scale insulin, which is you inject insulin according to the glucose reading that you would get when you're checking the blood sugar for patients. And that was the culprit of multiple hospitalization, that ER utilization that he had to seek for. In that process, I I was very religiously following the direction that was given by the doctor. So if you would get this much of blood sugar, you would give higher dose. If it's lower, then you would give lower dose. I was religiously following that, but that was actually the cause of these hospitalizations because there was no counseling about monitoring what to watch out for when my father would have low sugar. So 50% of insulin users, even more patients will experience hypoglycemia, which is a low sugar in your body at some point in their lives. Some people may not even know that they're experiencing low blood sugar, and it can also happen at night when you're sleeping. So this is a really red flag because he was an esophageal cancer patient. He couldn't eat. So right there, that's a red flag. But because I had no background in healthcare, I had no knowledge of um, medications. It was um, something bad waiting to happen when he was prescribed for it. And then when his blood sugar would drop, um, we would go to the ER, and then they would restore the blood sugar and discharge him without any counseling. Why he was there and what we could do to prevent another hospitalization. So we would repeat the same thing again 2 weeks later. And so what really happened was that because he was esophageal cancer patient, his um, food intake was, compromised. So he had to rely on feeding tubes. That can affect your sugar everywhere. That was one thing. And also, he was not a good water drinker. So if you're dehydrated, your glucometer can falsely elevate your level. And what am I doing? I am injecting high level insulin because the reading is high. So there's an intricate relationship that's so important for all diabetic patients who are on insulin need to be aware of. And we never had a chance to get acquainted with that kind of knowledge. There was no one who was explaining this relationship, who was explaining what diabetes was, who was explaining what insulin was. So I felt so compelled that if I had a pharmacist who could educate me or my father, I thought what my father experienced could have been prevented. So I changed my career to be a pharmacist. And 8 years later, or I would say, yeah, 8 years total later, I became a pharmacist. And after I became one, I realized I was just at the tip of iceberg. There's just so much in the iceberg that needed to change. So I began to seek what I could do in my position where I'm at, and I had to become an activist because of that reason. Because someone like my father, who was a minority and who was also a foreigner, that our healthcare system doesn't even worry about. I think I had to speak up for someone like him, and someone like me was a caregiver for my father. So that was the start of how I began starting to share my story and began to speak up for patients. I don't know
Wow.
if that answers my question.
Yeah. No, it makes sense why you go so hard for, this mission of yours, and why you do it. And, you know, patient safety, as I was preparing for our conversation, I was reading that patient safety is up there as far as one of the major killers of people in our country is patient safety. And
Mhm.
how are people to expect to improve this when they're not getting the appropriate information before they leave the hospital? And this is one of those
Right.
things, that this is why a lot of people of color or minorities don't really want to go to the hospital when they hear stories like this.
Yeah.
But what I believe, what I think is, having more people like yourself in there is really going to help. So, my question for you is, what role does cultural diversity play in patient safety? What have you seen, now being a pharmacist and being able to work with I'm assuming multiple different types of people. What role does your background and your story play in being able to help improve patient safety?
So it's interesting that I know there are movements out there and encouragements for minorities to be in healthcare profession for the reasons that you've talked about. So I've seen articles, I want black black people. There has to be more black doctors that black people can see, which I totally agree. There are so many different things that come into play when there is a trust issue. So this is something that um, I think is under recognized. I feel when you don't have the level of trust, you can't reveal 100% of you. But when you are in healthcare, that's what you're expected to do, right? Um,
Mhm.
but because of the level of trust that you may have with the healthcare professionals in general, um, and of course, there's racial bias and there's other factors that come in. Um, it's it's really difficult to even doing start getting to the right conversation about healthcare. So that's what I want to emphasize first. Um, what I'm trying to say is healthcare it starts at really deeper level. If you think about it, as a patient, you are expected to tell about yourself to somebody who you don't really know. I mean, if you think about when patients go to doctor's office, it could be a first time seeing that doctor. You only get 15 minutes, and you're supposed to tell all your story of like why you're experiencing your symptoms. That itself, if you just think about just that itself is a really difficult task for patients to do. And on the other side, for doctors to assess this patient and come up with a plan. So when it comes to diversity, I can see why people of color want to see other that healthcare professionals who are the same color as you, because I feel in patient's perspective, in that 15 minutes of time, you want to make connection real quick.
Right.
And when your race is the same, and especially for someone like me in Asian culture, when like every country speaks different language, right?
Right.
Every country in Asia speaks different language, even if it's a tiny little country. They want to speak in the language you're most comfortable with. So, and there's this notion that patients are being racist, and I think that's in general that's a misunderstanding. Um, Patients want to be heard. patients want to communicate. So I think that's number one reason why they are seeking the same racial background when they're seeking for healthcare professionals' help. So
Yeah.
I just want to throw it out there. So that misconception, I think it's a misconception that patients are being racist, because I've seen that kind of exchange of interactions in forums and platforms out there. So I think that's something that I want to bring up to you to begin with, so we can start in the right place.
Yeah, I think there's some truth to that. Just as a clinical health coach in our primary care clinic, there are times where black patients will tell me things that they have not told their white provider.
Yep.
There's nothing I can do about it but put it in the note. But it happens. But
Mm-hmm.
my question to you, Soojin, is what about what do we do, or what do those providers do who may not there may not be a provider for someone who's from
Mm-hmm.
that they just have no choice. They have who they have.
Right.
How
Right.
can a provider be more culturally competent to be able to provide the best possible care they can for that patient, given that they're the only option they have?
Mm-hmm. Right. Right. So I think there's more movements out there nowadays about more awareness about health equity and implicit bias. I feel like everyone has that, right? But I think
Yeah.
you need to be able to catch yourself when you have that. And so noticing yourself and being self aware is something that feel every healthcare professional needs to think about. But that goes into deeper level for me. And I feel that I want healthcare professionals to be able to look into themselves. So this is where trauma informed care that I advocate for comes in. Um, and it's healthcare profession healthcare is a very difficult field to work in. So our system is broken, of course, but also there's self criticism, peer to peer criticism, blaming, shaming, these unhealthy behaviors that exist in healthcare. It's so rampant. It's mind boggling. Um, so recently there has been a case of a nurse who mistakenly injected a medication and a patient died, and that case has been very public and has been very publicly blaming the nurse without really investigating further and going deeper level for the system. So that's a very good example where our patient safety status is. It's a very good example of where we are, how it shows, how it affects healthcare professionals. So there's this big system level change that needs to happen. But as an individual, I advocate for looking into themselves and being self-aware about possible traumas, whether it's at healthcare professional level, whether it's childhood, that's affecting your professional work. Because I see it in so many places. It's very obvious to me and evident to me that like I can see like why some people are so reactive about some of the comments. Um, it could be cultural thing too. Some cultures it's okay for it's not okay in our in the United States, but it's in their home country child abuse was okay, like hitting children was okay. You know, this is like accepted behavior. So there are things that we kind of are doing things like an autopilot. We are doing things without being conscious about what we're doing wrong. So I think examining yourself and how you are practicing medicine is affecting patients is just so enormous. I can't emphasize enough that how important it is to be self-aware and looking into yourself, because this does get translated to your practice and in the end to the patient.
No, absolutely. That's very good. And understanding that you're not a trauma informed care expert, but an advocate for it, for someone listening who wants to. And you gave some great advice, but for someone listening who wants to be more mindful of, different traumas in different cultures, there are different things that affect different people. So what are some first steps someone can do to really start to look at their practice and really implement more of a trauma informed care?
So there are organizations that are dedicating their nonprofit organizations that are dedicating their efforts into educate people and healthcare professionals to be more aware of trauma informed care. So I would follow those nonprofit organizations. Um, there's also a book called Body Keeps the Score.
Mm-hmm.
It's a very well known book about trauma informed care, and also there has been a recent book by Oprah Winfrey and Dr. Bruce Perry called "What Happened to You." So that book really helped recognizing my own trauma, and it really helped my healing process as well, personal healing process. So I would recommend those books, and really look into yourself first before advocating for other people, because I I I realized that I had to transform myself first in order for me to be able to advocate for other patients, whoever I'm advocating for, because I really feel we are all connected, and our energy, whether it's negative or positive, can really transpire to what we are communicating. So I felt the healing process that I had for myself was so important for my advocacy work.
No, for absolutely. I mean, and that's something we don't really think about is focusing on ourselves first.
Mm-hmm.
Because I can only assume that you're a caregiver. Obviously, you are a caregiver. You are in a helping profession, so you want to help people before you help yourself. But can't really do that if you have not really focused on yourself first. So I really appreciate that. Um, so if we can
Yeah.
kind of touch on a little bit of the work you're doing with patients for patient safety. Um, it looks like you guys are committed to implementing the World Health Organization's Global Patient Safety Action Plan in the U.S. Can you tell us a little bit about, what that plan is, and kind of how are you guys going about implementing it or doing that?
So so WHO has put out this action plan out there, so it can be a guideline for all healthcare organizations across the globe to follow, in like focusing on what areas, what like I guess naming what areas to focus on patient safety. So one of them is patient engagement and really working with patients to um, improve patient safety. And if you think about that, it to someone like me, it's no brainer. But in general, how our healthcare is has been in the past, healthcare in general is very hierarchical. So we say prescribing meds, right, to patients, and it's more like a top-down approach. But what WHO is advocating for is bottom-up in a way. If we are still in that hierarchical mindset, but actually, what what we are advocating for is that patients are partners. Patients are partners in their care, and this is very important to be aware of, especially when our healthcare is going towards chronic care model. A lot of healthcare methodology and didactics that are taught in school are acute care model. I'm not saying that's not important, but chronic care is a different. There's so much that goes on to it's a different didactic. It's a different methodology, in a way, because you have to look at a long-term goal. You have to work with the patient for long-term. So many things we have to really think about the paradigm shift, and this action plan can be a guideline for healthcare organizations to really think deeply about how we're practicing medicine. So our goal is to make patient safety as a priority for all healthcare organizations in the United States. So there are other patients for patient safety organizations out there under WHO's umbrella, like we are. So there's Patients for Patient Safety Ireland, for example. So each country can create their own Patients for Patient Safety organizations under WHO. But for us, of course, there are other healthcare organizations in the United States, but all our founders felt there wasn't one that were affecting at policy level. So we were formed to affect how policies are shaped. We wanted to affect how patients and caregivers' voices are heard at policy level. So we have worked with organizations, the governmental organizations like CDC, CMS, and it's a time where I feel these organizations are more open than ever about patient engagement.
Right.
So it's a great time for us to really engage in these talks, and I'm very new in the group, but other founders have been involved with these organizations for decades. So it was really exciting and encouraging to see how quickly they were able to set up a meeting with leaders in these organizations and have some momentum in what we are pushing for and what's really, and emphasizing what's really important for patients. So so that's our goal. And because patient safety is such a broad term, and because of different priorities and different things coming up in healthcare, the word patient safety tends to get dropped as organizations prioritize different things, and but we feel that needs to change. Patient safety has to be always there for healthcare organizations. It has to be like a North Star for all healthcare organizations. So that's what we are focusing on.
That's awesome. Thank you for that information. And by the time this episode goes live, it'd be what is it, Patient Safety Month or day or something like there's some day coming up to recognize patient safety, correct?
Yeah, so September 17th is World Patient Safety Day. So buildings around the globe are encouraged to light in orange. So you will see WHO buildings in Switzerland and other ones in the Europe being lighted in orange, and that has kind of come to United States over the years. So I've seen some buildings lighted in orange and in support of World Patient Safety Day. We are also organizing a march in Washington, D.C. in Freedom Plaza on September 17th. If any of the listeners is interested in joining us, please contact me. It's September 17th, 10 a.m. at Freedom Plaza. There will be about 50 of us, hopefully. We are still spreading the word out and hoping that many people will join us. But just to make people aware of this day, how important patient safety is in healthcare. We are doing these events for World Patient Safety Day.
Awesome. Well, I'll make sure I have all those links in the description of this episode. So if people wanted to learn more about that, they know where to go. Well, Soojin, thank you so much for being on the podcast with me today. I really appreciated the conversation. For anyone listening that wants to learn more about you and what you're doing, where can they find you?
So our website is at www.pfts.us. So you can check our website, and in the Contact Us button, you can sign up as a champion. Or if you're interested in partnering with us as an organization, as a strategic partner, you can also fill out that form.
Awesome. All right. Well, again, thank you so much for being on the podcast with me today. I really appreciated it. And everyone, thank you for listening to the Healthy Project podcast. I'll let you next time.